Top questions of getting a medical alarm system, part 2 of 3. In part 1 of this series, we covered the general aspects of a medical alarm system. This part will go into more detail about getting medical help quickly. In some cases, your loved ones need more help than you are able to give them yourself, typically because you are either still in the workforce or because you have your own children that are still being cared for, or sometimes both. For others, it is the inability to care for them as well as you would like to. It may be that you do not have any extra room in the home or lack the physical strength to pick them up after a fall. In these cases, many start looking at nursing homes and other assisted care facilities. However, if your elderly loved one does not need the full care of assisted living but does need extra help now and then, you should look into a medical alarm system as a possible alternative. Getting medical help fast. The primary function of a medical alert system is to summon help when the button is pushed. Once that button is pushed though, the type of system being used determines what happens next. They can either call a central monitoring station or a list of phone numbers. Before selecting which type of system to use, you should do an assessment of what the more likely reasons that button will be pushed. If there is a low incidence of needing medical attention, then a system that calls a predetermined list of phone numbers might be best. If there are friendly and helpful neighbors nearby that are willing to help, these might be the first numbers that the base station dials, as they will be the closest and able to respond the fastest. If there are no willing neighbors but family members are reasonably close, this should be the next set of numbers you program in the unit to dial. Even if there are neighbors, this is the next logical set of people to call out to. Most of the systems allow the person who answers to be able to activate the unit's microphone and speaker, allowing to talk to the person who needs help. This ability to speak to the person directly makes it more convenient for the person to find out what has happened and be able to make the decision on what the next step needs to be. This next step could be calling 911 and summoning medical help for them, or letting them know that you are on your way. This direct communication allows you to have a direct response capability, so that even if you are living across the country, you are still able to help your loved one. Obviously, if there are a good number of people that are willing to be on the call list and are willing to learn how to remotely control the base station, then a non-monitored system is probably the best choice. If, however, there are a few people or none local enough to get there in a short period of time, then a medical alarm system that is monitored by a central monitoring station would be a better choice. Look for part 3 of the continuation of this article, in which we will discuss the systems and what happens when the button is pushed.